Employee well-being, sustainability as the solution in healthcare. Hello, I'm Kate Gottlieb. I wanted to share my journey of how I started my career in environmental sustainability. I am currently a member engagement manager for Practice Green Health. My portfolio of members are in California, including Children's Hospital Los Angeles, and many in the Pacific Northwest and Midwest. I help our members with support and resources, goal setting, overcoming barriers, and my passion is connecting community health and wellness to sustainability in healthcare. Before joining Practice Green Health in February, I worked for a community hospital in the community health department, starting out in childhood obesity as a program coordinator, and then in employee health, implementing an employee well-being program. In 2016, I became the sustainability program coordinator, implementing a comprehensive environmental sustainability program. I have my master's degree in health education with an emphasis in community health. My bachelor's of science is in public health, and I hold multiple wellness certifications. I currently reside in Yakima, Washington with my husband and son. During this presentation, I will be sharing my journey of how an employee well-being program turned into an environmental sustainability program, and how Practice Green Health's environmental excellence application led us to a top honor as a top 25 hospital for environmental sustainability. But first, why sustainability in healthcare? Well, healthcare has a huge impact on our environment. And healthcare, as the only sector with healing as its mission, has an opportunity to use its ethical, economic, and political influence to create a sustainable, equitable, and healthy communities in general. Practice Green Health is the leading membership and networking organization for sustainable healthcare, delivering environmental solutions to more than 1,000 U.S. hospitals and healthcare systems. Healthcare Without Harm seeks to transform healthcare worldwide, so the sector reduces its environmental footprint and becomes a leader in the global movement for environmental health and justice. Together with several leading U.S. health systems, Healthcare Without Harm and Practice Green Health launched Green Health Exchange, the first sustainable purchasing cooperative that facilitates the procurement of products and services that are good for people and the planet. The Healthy Food and Healthcare Program harnesses the purchasing power and expertise of healthcare sector to redefine hospital food, activate its potential to heal people and communities, and adopt practices and policies to support a healthy, sustainable food system. Consider these difficult truths or hard facts to regard healthcare's financial and environmental impact. Healthcare compromises 18% of all gross domestic products. It's determined that by 2040, they'll be at 34%. Their hospitals are often a top water user in a community, and per day produces 30 plus pounds of waste per hospital bed. That's 59 million tons a year. And this stat is a little outdated, which this makes this number a little bit more, especially given a pandemic year. If the global healthcare sector were a country, it would be the 5th largest emitter on the planet. But how? These are the common greenhouse gas emissions that are broken down into the following scopes. These greenhouse gas emissions are common sources in healthcare. Scope 1 covers direct emissions from owned or controlled sources, such as on-site energy, fleet vehicles, or waste anesthetic gases. Scope 2 covers indirect emissions from the generation of purchased electricity, steam, heating, cooling, consumed by the reporting company, where Scope 3 includes all other indirect emissions that occur in a company's value chain, such as business travel, pharmaceuticals, even the procurement of meat. Healthcare has an opportunity to be a leader, mitigating healthcare's impacts on the environment and public health, creating community health and resilience, and advocating for policies that are more protective of human health. Healthy people equal a healthy planet, but you have to have a healthy planet for people to be healthy. There is evidence that healthcare can also save money while becoming more environmentally friendly. One of my hospital members is eliminating a chemical of concern from their IV bags, and they will have a cost savings of $400,000 annually. And from our benchmarking and our application process, Practice Green Health members can save more than $1 million annually from initiatives drawn from our sustainability agenda. Now, employee well-being. How does this all relate? In 2014, my department received an endowment from a physician in his late wife's honor to focus on improving the well-being of healthcare workers. There were some things we had in mind. We knew that if we had well staffed, we could drive significant organizational outcomes. We knew that a well employee was more productive. They were more likely to volunteer, more likely to recover from illness, hardship, less likely to miss work due to poor health. If we focused on the 8 dimensions of well-being, then we could address all areas that affect the overall well-being of the employee. But we had a lot of work to do. We knew that we had to embed well-being into our culture of the organization. And luckily, we had a CEO who truly believed in this approach. We had to remove barriers for a successful launch of well-being programs and create an environment in which our employees could thrive. How do you get employees to be well when you have all the social determinants affecting their health? Like the 8 dimensions of well-being, it plays on the social determinants of health also. All of these areas affect a person as a whole. Having access to housing, transportation, whether they have a background of education, whether they're experiencing hunger, or their children are experiencing hunger, or family members, whether they have access to care. We started with several employee benefits to increase overall well-being. All of these were great opportunities. But how are we going to get employees to engage? We had subsidized corporate gym memberships, We had farmers markets and access to CSAs, community supported agriculture. We launched Healthy Choices, Healthy Yakima vending in our cafe. We had healthy lifestyle programs, including the diabetes prevention program that was free of cost to our employees. We had a bike to work program. We increased bike racks around campus. We had water bottle filling stations. We even included an Apple delivery program for our employees. And we started educating and stairwell prompts. A person usually makes decisions for behavior change based on the stages of change model. When you have nurses and other clinical staff stressed and in that hot zone, taking care of patients, how do you get to them to focus on their own well-being at the end of their 12-hour shift? It has to be a change that comes from within that individual. Embedding well-being into the culture and focusing on the environment of the workplace could help, especially during a year that we have seen and the impact of the pandemic on employees' overall well-being. We really want to see an individual contemplating the change and then preparing it, so changing the environment around them and then taking action. And while they're in that action phase, if they have a slip up, I believe in everything in moderation. They can go back into that action stage and that preparation stage. It's truly a working model. This is where we moved on and learned more about environmental sustainability, specifically to healthy food and healthcare. Due to a key retirement of our dietary food director, it led us to a fresh start. And this is where we had the signing on to the Healthcare Without Harm's Healthy Food and Healthcare Pledge. We made it a huge event. We had the local media there. We had our whole C-suite attend, and the CEO was the first to sign on to the pledge. We wanted to support a healthy environment for our employees to make behavior changes. But we had to remove barriers, making the healthy choice the easy and affordable choice. Communications and marketing helped us with messaging, and we started celebrating. We celebrated national event days like Food Day. We started a cafe garden, on-site cooking classes, and started a farmer's market with healthy food tastings of recipes featured in the cafe. Here I am right here holding up some cucumbers and zucchinis that we harvested in our garden. And we had the on-site daycare facility bring over some kids to help us harvest the food in the garden, so that the kids can learn more about farm to table. Data was key. We saved money by growing our own organic produce. We removed sugar-sweetened beverages from our patient menu offerings, saving the organization over $40,000 in product, and I'm sure more money over time with diabetes meds to counter the blood sugar spikes of the free soda that they were receiving at bedside. The Food Forward program with the National Humane Society came in and provided a free cooking training to our dietary department on food forward meals. Our dietary department felt bought in, and they started to thrive, and the staff started to even adopting these positive changes as well. For example, we had more people in our dietary department requesting milk alternatives. As healthcare organization, we had much more work to do. We learned more about what sustainability was in healthcare. Sustainability not only supported patient health, it got us more engaged around big picture thinking, providing leadership more opportunities to get involved. We started seeing dollars saved that could be used elsewhere. And overall, it was the right thing to do for our planet. From there, with Healthcare Without Harm and the Healthier Hospitals Initiative, we signed on to work more on leaner energy, less waste, safer chemicals, and engaging more of our leadership around how they can help us make a difference in these areas. We started small. Our well-being team turned into our green team, and we recruited more champions around sustainability from other departments such as facilities, the lab, pharmacy, supply chain, the OR, the operating room, and many others. These are some of our initiatives that addressed improving the environment for behavior change. Partnerships are key. We had to break down silos, watch out for barriers, and talk more about vending and how we provide healthy vending. And I would like to address that in our Q&A after. So I hope we have a question out there around how we implemented healthy vending. We improved through return on investment projects and saved dollars in addition. We were also reducing our carbon emissions through heat recovery projects. We replaced some old boilers. We implemented LED lighting throughout the hospital, including inside and outside. And we also worked on air regulation. We also ignited our old recycling program. We partnered with a local recycling center and started making a profit on the excess paper people were throwing away, the aluminum cans throughout the hospital. We also worked with our pharmacy on recycling our pharmaceutical containers that were going into our landfill. We also launched a Think Before You Print campaign and shifted from paper to electronic communications. At that point, we were ready and we had the infrastructure to join Practice Green Health and learn more about the 11 strategic areas and all of the turnkey toolkits and resources that they had or have to touch on each topic area. Now, I would like to share the most recent video on doctors fighting climate change and the impacts of fossil fuels on human health. And after, we'll kind of talk about what you can do to have an impact on environmental sustainability.
I used to see black spots on the lungs of mostly smokers. Over the last decade or so, I saw a series of teenagers with black spots on the lung. And I thought to myself, oh my God, what's happening?
What could be causing this epidemic of lung disease? The answer, it turned out, was in the air.
In India, the bulk of pollution comes from crop burning, garbage being burned, vehicular pollution, and industry releases tons and tons of toxic smoke into the air. I have seen it with my own eyes. We need to do something about it.
Fossil fuel combustion is a main cause of air pollution in India and around the world. It's also the biggest driver of climate change.
Our experience across Australia was an extraordinary experience. times. We had weeks and months in some places of hazardous air pollution and poor air quality. Some thousands of people were in hospital with heart disease and arrhythmias. They had heart attacks and strokes. We know that lung infections and pneumonia is made more likely by exposure to air pollution of that nature.
Health professionals are realizing that climate change is one of the greatest health threats of the 21st century.
Climate change is fundamentally a public health issue. We know from ample evidence that we are in a critical moment when it comes to climate action. And unfortunately, the healthcare sector, both in the US and around the world, is a huge contributor to global greenhouse gas emissions and climate change.
If healthcare was a country, it would be the 5th largest climate polluter on the planet. And if we're going to protect people's health from climate change, we need to move away from fossil fuels.
The sector needs to take action to reduce its own emissions.
These are doctors from all around the world tackling climate change as a public health crisis, while also bringing sustainable practices to a major contributor to climate change: healthcare.
I do get asked sometimes, why would a pediatrician be involved in climate action? I feel that it is my duty to think about what are the factors outside of my clinic that really are contributing to my patients' well-being. If the operations of healthcare delivery are doing harm, that seems completely antithetical to the oath that I took.
What we need to do is really reinvent healthcare in the 21st century.
Overall, the biggest source of healthcare's climate footprint is the sector's use of fossil fuels, whether it's burning fossil fuels on site to produce energy, whether it's buying energy produced by coal, oil, and gas, or whether it's in the supply chain, which is a huge part of healthcare's footprint.
What shifted for me in the last year or two has been the profound recognition that climate change affects us now. If we were better at addressing disease before it gets to the point where people end up in hospital, then we can significantly decrease the carbon footprint. We need to be proactive in taking that longer term view.
When healthcare providers realize that their actions and the sector that they work for is actually contributing to the burden of disease, they're ready to take action.
The whole debate about climate change is live in our community. There has been a central commitment that the NHS will meet net zero by 2050. We employ around 1.7 million staff. I think we're the 5th biggest employer in the world. We're responsible for about 5% of the UK's carbon emissions. At Newcastle hospitals, we now recycle 43% of our non-clinical waste. 60% of our staff come into work using sustainable modes of travel, and we've banned use of diesel and petrol cars in our fleet.
Doctors, nurses, hospitals, and health systems in more than 70 countries have joined together with the international network Healthcare Without Harm to build a global movement for sustainable and equitable healthcare, for clean air, and for a healthy climate.
If we look at this health and climate change dynamic, we see hope. We see hope because individual action makes a difference to your health and well-being.
So the first step to solution is to become aware, awakened, and then only the action will come.
Health professionals today who are interested in climate action have so many opportunities to get involved that relate to energy efficiency, clean energy, sustainable purchasing, healthier foods. We're very powerful as exemplars for our patients.
Two of the greatest health threats of the 21st century are climate change and the global pandemic. And we've got one on top of the other.
I am optimistic that if we can contend with one threat at the moment, we can probably contend with a whole series of threats at the moment. It's the most extraordinary time to be imagining the human future.
If you want to have healthy people, you need to have a healthy planet.
For more on how health
This video has ensured me that healthcare can be a leader. They can help the cause. To make it easier, they can partner with community and be the anchor institution throughout community benefit investments. I wanted to share a few community partnerships that I partaked in. So for one, the National Drug Take Back Days, it's a partnership between the DEA, our police departments, and community members. So we partnered with our local police department, and we had a site where members of the community can come and bring their excess or outdated pharmaceuticals. It could have been over-the-counter drugs or prescription. We hosted this twice a year, and the amount of pharmaceuticals or over-the-counter drugs that we collected, I mean, thousands of pounds we've collected twice a year. And this helped us keep the pharmaceuticals out of our water, educated people on proper disposal. There were lots of win-wins here. We also had Earth Day events. So, for example, we know of some people that had shred events. We had recycling days for Earth Day, where people could bring old fluorescent lighting, batteries. We also had a bicycle recycling program where we had an organization, we invested into an organization that fixed up old bicycles and then repurposed them by giving them to children in our community. We worked with some churches in our community that had community gardens. And then there's also opportunities to invest in infrastructure. So for example, more walkable communities, more green spaces. How can healthcare invest in community benefit programs, focusing on the social determinants of health and environmental sustainability? How can you make the connection and make that investment? Many people wonder, if we're just getting started, how do we get started? Well, there are a number of resources available. If you are a physician, you can join the Physicians Network and learn more about environmental sustainability and how you can get involved at your healthcare facility. We also have the Nurses Climate Challenge, which you can see the links are right here. And I'm also sharing these resources. You'll have these after the presentation today. And one of my favorite resources that I used a lot was at Harvard and their sustainability website. So you can see the link up here. But it gives you ideas on kind of like low-hanging fruit that you can take advantage of. So simple things. It has marketing materials. So how can you get people to just like turn off the lights or unplug things? And so it can be as simple as that. Unplug your cell phone charger. But as you can see, there's a number of resources. Practice Green Health is a membership resource, which I'll talk about here in a minute. But Healthcare Without Harm has a number of resources available, and you can kind of dig into many more of these. So with Practice Green Health, if healthcare is everyone's business, then we believe that certainly transforming healthcare should be also. The challenges of environmental stewardship, climate health, and addressing the social determinants of health stand to benefit from the creativity and collective work of all organizations and voices. So I wanted to share these opportunities of how many can get involved with Practice Green Health. So whether you're a hospital or health system partner, you can become an affiliate partner. So if you're a business or a supplier, you can become an allied partner. So for example, government agencies or other nonprofits, this is an allied partner. We want you to be aligned with our mission, resources, and efforts to advance sustainability. And then the last one is an academic partner. So these are colleges, schools, really that knowledge producer. How can you guys get involved? Especially nursing schools, medical schools, schools of public health. These are all some great opportunities. And if you go to our website, you can see the fee schedule associated with a few of these different partnerships. I hope that you leave here today knowing what you can do to make a difference at your organization or in our communities. I want you to be an advocate for climate change and for environmental sustainability. You can start small, like I said, with the low-hanging fruit, the easy things, by making a difference as an individual and then influencing others. Engage your coworkers that are passionate about environmental sustainability and well-being. The next generation of healthcare workers expect their employer to have a trustworthy leadership. They want to work for an organization with a sense of purpose. The next generation believes in climate change and wants to work with an employer that not only shares the view, but acts on it. I hope that you can leave today learning more on how you can get started. I look forward to your questions and I hope I can provide answers. And if not, I will get you the answer. So please ask away. I believe the questions are coming on Umbrella and I'm going to go ahead and let the moderator take over. So thank you for your time today. If you have any questions afterwards, in the weeks, months to come, here's my contact information, and I hope that you reach out. Thank you.
Thank you so much for that presentation, Mrs. Gottlieb. So we have a few questions from Elaine. The first one being, what did you see as the biggest barrier to individuals adopting change? And do you have any success stories or moments you're able to share?
So with individuals adopting change is scary. And I think people are scared of change and what is to come with change. So yeah, we had pushback. We had people that, you know, why are we doing this? What is this benefiting? This is an extra step I have to partake in. And so the pushback we would receive at first, you know, I think it was just they were scared. But it ended up being, once we implemented it and they saw that it's really not a burden, it's really a benefit. And once people started talking about projects and the word got around and we were able to show data and the success and the impact, they started buying in. And what I found, if you have people that are experiencing, you know, pushback, make that personal connection. And when you make a personal connection, for example, when I used to do well-being work, I used to start with who in here knows someone or has experienced cancer. And to see people that would raise their hands and look around the room and realize that everyone had something in common, then you start connecting to their story. And so if you can connect with people, I think that helps the pushback or, you know, the barriers with implementing new programs.
Thank you for that. I'd also like to add, if anybody wants to ask a question live, you can go ahead and feel free to press the raise hand function and I can unmute you and you can share your question verbally. But a second question we have is, how did you implement a vending program for healthy food?
So implementing a healthy vending program wasn't as easy as you think it would be, as there's always a little glitch or something that you just don't realize. So for example, all the money raised from our vending machines, the Coca-Cola company implementing the vending machines actually donated to our foundation, helping kids in the NICU and helping pediatrics. And, you know, so it's this vicious cycle because you're wanting people to eat healthier, but then the money being raised actually helps a cause, right? So we worked with a third party vending company. So we actually went to Clean Med, found out about this third party vending company that supposedly helps you implement healthy vending. So we brought them in. And when we brought them in and signed, they reached out to Coca-Cola. Well, we had a barrier. Coca-Cola, the owner in our small community, was on our foundation board. And he called up our CEO and he said, you break this contract with this third party vendor, or else you're not going to get funding or your fundraising events. We're not donating water or soda or anything. And so what did the CEO say? Stop this contract. So then that's where we had to establish the partnership and make the connection and talk about the cause. And so luckily I got with the vending manager and we came up with a solution. We went 50-50, and in some vending we went 60-40, and it was all about placement. The healthy products went at eye level. The unhealthy products went above or below. And actually in Washington State and probably California and other states, there's a lot of healthy vending guidelines. And so there's a lot of toolkits out there that help make the solution easier. And so we really tried to leverage like the Washington State's healthy vending policies and guidelines, and and I know schools also have some guidelines. And so we really just had to keep pushing a little bit and then pushing a little bit more. And so it was definitely a process.
Kind of as a follow-up question to that, how did you end up removing the junk food?
Well, some of the junk food was never removed. We had to actually just do what we could. So where we had control was in our cafe, and our cafe eliminated the unhealthy options. So for example, we went in and we looked. It used to be you walk into our hospital cafe and the first thing you saw was this big dessert bar full of all this delicious foods. Well, we revised it. We put the dessert bar far at the end. We put healthy grab and go items right up front. There used to be a soda fountain machine and it used to light up. We turned off the light and we highlighted the healthy options in the soda fountain machine. So we started doing changes where we could and where we could see, some change. And then with the healthy vending, we just really worked on placement. We worked on 60% healthy, 40% unhealthy. And we really just tried to do the education, right? We tried to market, we put up signs like, make the healthy choice, we put up calories, that was a good option. And then in our cafe, we also labeled things. For example, this is the healthy choice, and we put like a little icon up there. So when trying to implement healthy vending or healthy food in general, it's really like, what can you control? How can you change the environment more so than eliminate, and help have people make that healthy choice instead of the unhealthy choice?
Thank you for that answer. I know I've definitely seen that dessert bar you were talking about in the cafe, but we have another question from Elaine. Have other hospitals adopted this program?
Which program?
Just the healthy program and the vending and just the sustainability, that type of program in general.
Yeah. So for example, with our with the Practice Green Health membership, we have over 1,000 members throughout the US and other parts of the world through our Healthcare Without Harm extension. So for example, I mentioned Children's Hospital Los Angeles. They actually joined Practice Green Health last year, and they're in the beginning of really expanding their green team and starting working on a checklist that will help them address, what are their biggest opportunities for implementing sustainability programming. And then I hope that everyone's kind of looking at, employee well-being and, helping their employees stay healthy, especially given, the COVID year and the pandemic and all these employees that are just exhausted, and, how can they focus on themselves and their own well-being before going home and taking care of their children? How, by the time they leave work and then get in the car and go home, what is something they can do for themselves? And so I'm hopeful that healthcare is really addressing this.
And for our next question, what is some low-hanging fruit to get started with sustainability initiatives, and where do I start?
Yeah, so I actually took some notes. I have some just talking points to this. But really, it's about doing an environmental scan. So what are you currently doing? What are like your biggest opportunities? So for example, if you know your data, say it's around energy or water or anything operational, and starting like doing, if you have baseline numbers, then you can kind of see improvements over the years. So for example, if a hospital has an EUI of 300, that's really high. We want to see them well below or around 200. And so looking at other benchmarking throughout the US and seeing where you lie would be a great place to start. Also look at your challenges or opportunities. If you have, what I found, I actually had a lot of staff just raise the question. Like we had a employee weekly memo, and I would put in sustainability, things we were doing around sustainability, and I would highlight like Bike to Work Month and just these programs that we had. And then I had people of interest start reaching out and asking questions. Or for example, we had been doing, refreshing our recycling program for a while, but then I have a new nurse that's not educated, and, she comes to our meeting and she's like, why aren't we doing this? Like, we should be doing this. And yeah, those passionate ones, those are great, because you're like, yeah, we should be doing this. And you can help us be the leader. You can help us make the change by advocating in your department. Bring it up at your next department meeting. Then it's going to get your manager interested, and then we can take it to another level. So really, just like I said before, connectivity. The more you educate, the more you reach out, the more you talk to people, find out their interests. That's, I would say the biggest opportunities.
So we have about 5 minutes left, maybe time for one or two more questions, but the next one is, how did you market well-being? How did you market well-being?
So with well-being and other terms like sustainability or plant-based or wellness, or you kind of want to change it up so people don't put a stigma around those names. And so, for example, when we used to talk about stress management, we changed it. We said, let's talk about mindfulness. How can we be more mindful? Or instead of wellness, we talked about sustainable engagement. Or in our cafe, we used to say, oh, this is the vegan option, or this is the plant-based option. And people are like, or we even had staff members serving food behind the glass, and they would tell people, oh, that's vegan, like it was a bad thing, or like, and then people were like, oh, I don't know what that is. Just call it what it is. If it's a lentil loaf, call it a lentil loaf. If it's chana masala, call it chana masala. If it's a black bean burger, call it a cowboy burger. It's going to sound manly. People are going to want to eat it. So, it's real food. Just call it what it is. And so when you start marketing foods, just, or different things, another one is, when you just talk about health, let's talk about your energy and your energy levels, and, not just your overall health. If you're in poor health, how's your energy level? Are you feeling low? So that would be my answer to, how do you market the terms of wellness or well-being?
And then I think we have time for one last question. Where do you see this evolving in the future?
Well, I honestly see sustainability as the cornerstone moving forward for every business, every organization. I see it as everyone's responsibility. So, for example, how we are addressing the pandemic we're facing right now in COVID, you're responsible for your own health. You're responsible for wearing a mask and making decisions not to engage. Well, with sustainability, you are responsible for recycling your own trash, doing compost, bringing your own bags to a grocery store, making the choice, making that decision. And then for your young ones, teaching them what's right and wrong. And it's not wrong, it's just the better choice. And so I see businesses as a leader. I see businesses making choices to make an impact for a healthier future for our population and our planet.